All right, so today we're diving deep into the world of health plans.
Always exciting.
Right. Specifically, we've got our hands on this healthy PPO plan. And I think for anyone who's ever had to pick a health plan, which, let's face it, is most of us.
It's like deciphering a whole new language.
It is. It feels that way. You just want to know, okay, cut through the jargon. Just tell me how this thing works. What's different about it?
Right.
And I think with this healthy PPO, it's kind of interesting because it tries to blend something familiar
It does.
with a little bit of a new twist.
Yeah, you could say that.
So when we say PPO, Preferred Provider Organization,
Right,
what's
right.
that all about? Just to give us that baseline.
So with the PPO, essentially you're talking about having a network, right? A network of providers. So
Yeah.
you've got your doctors, you've got your hospitals.
Your trusted kind of go-to.
Exactly. And usually you'll find that if you stay within that network,
Right.
that's where you're going to see the most kind of bang for your buck in
Yeah.
terms of your coverage.
Makes sense. So that's kind of the traditional side of this healthy PPO. But then they add in this whole ShareWell health share element.
do.
And that's where we kind of step outside of just typical insurance.
Yeah, that's where things get interesting. This is where we're really talking about more of a, community approach.
Yeah.
Where you've got a group of individuals.
Barbers.
Yeah, members of this ShareWell who are essentially all sharing in the cost of eligible medical expenses.
Okay. So it's almost like, I don't know, I think like almost like a crowdfunding campaign, but for your healthcare that's built into this plan.
Kinda.
Yeah.
Kind of, yeah. I mean, the fundamental idea is that you're pooling resources together
Right.
to kind of help mitigate those costs. And that's really where the big question comes in, is how do these two things, the PPO network and then this health share concept.
Right. How do they play together?
Exactly. And what does that mean for you? What does that mean for your healthcare?
So before we unpack all the specifics of that, I'm curious, just hearing about this idea of cost sharing in this way, does that raise any immediate kind of questions or concerns for you?
For me, I mean, it definitely raises, some questions about how that plays out in different health situations, right? I think about folks who maybe have, pre-existing conditions.
Yeah.
That's a big one.
And we're going to get to that for sure.
Okay, good.
Because, like with any healthcare plan, as they say, the devil's in the details.
He is often.
So we're going to break down, really what this healthy PPO covers, how it works, and ultimately, what it might mean for your wallet and for your well-being. All right, so let's dig into some of the nitty-gritty, the nuts and bolts of this healthy PPO. What are we talking about when we look at those, essential checkups, those preventive care visits?
So that's one of the kind of the bright spots right off the bat, is that the healthy PPO does tout 100% coverage for those preventive services. So we're talking, your annual checkups,
Right.
your screenings, your, routine vaccinations, all that kind of good stuff to keep you ahead of the game.
Okay, so that's a sigh of relief. And that's pretty standard these days, right? Thanks to the Affordable Care Act, a lot of plans have kind of jumped on that prevention bandwagon.
Yeah, you could say that's kind of the baseline expectation now.
Right.
But I think where things get a little bit more, into the nuances is when we start talking about, okay, you actually need to see the doctor.
Right. Beyond those preventative things.
Beyond those preventative. So this is where, copays come into play.
Okay, let's talk copays, because let's be honest, that can be where it really starts to add up.
It sure can.
So what are we looking at here?
So if you're talking about those kind of regular visits to your primary care physician.
Your PCP.
Exactly. You're looking at a $25 copay for that. And the nice thing is there's no limit on the number of visits.
Okay, so if you're someone who, maybe you've got a chronic condition or you just like to, touch base with your doctor regularly, you're not penalized for that.
Exactly.
Okay, that's good to know.
Now, when we shift gears and we start thinking about specialists, that's where things,
Because you need those specialists, but they can get pricey.
They can. So you're looking at a $35 copay for those specialist visits, but you are limited to 5 per year.
Okay, so there's that limit, which makes sense.
Yeah.
Because, again, those bills can add up.
Right, and that's where, that PPO network really comes into play, right?
Choosing wisely.
Choosing wisely, exactly. So then thinking about, okay, what about those kind of, moments, right?
The urgent care.
The urgent care. You didn't plan for it, something comes up.
Exactly.
For that, you're looking at a $50 copay, and you're allowed up to 3 of those visits per year.
Okay, so
Yeah.
a little bit more of a financial ouch if you find yourself in that urgent care situation, a couple of times a year. But I guess they can't predict everything.
Right, exactly, exactly. Although I will say they are kind of ahead of the game in the sense that they offer unlimited virtual urgent care visits for $0.
Okay, so telehealth to the rescue.
There you go.
I like seeing that. I feel like more and more plans are embracing that because it's 2024. We want that convenience. We want that accessibility.
Absolutely.
So we've talked about checkups, regular doctor visits, specialists, even urgent care, both in person and virtually. But we're missing one pretty crucial aspect of healthcare, which we haven't even touched on yet.
Prescriptions.
Prescriptions, of course.
And that, I feel like that's where it can get a little...
That's a whole other can of worms, right?
Exactly.
With the tiered formularies and everything. So let's maybe take a quick pause here, and we'll come back and we'll dive into the wonderful world of prescriptions with the healthy PPO.
Okay, so we're back. And we're ready to tackle this whole prescription drug situation with the healthy PPO because, as anyone who's ever had to refill a prescription knows, it can get complicated.
Oh, absolutely.
With the different tiers and all of that.
Yeah, the formularies.
Right, exactly. So how does this healthy PPO handle that?
Well, they, like many plans, they do use a tiered formulary system, but there is some good news here, I would say. They actually offer over 1,000 commonly prescribed medications.
Okay.
For, both acute and chronic conditions, completely free of charge.
Free, like $0.
$0.
Wow, okay.
So that's a pretty significant benefit.
It is, especially, I would imagine, for folks who rely on, maybe some daily medications for chronic conditions.
Absolutely.
That could be a game changer.
Yeah. Now, if your medication isn't on that list, and they do have a pretty expensive list, there's a second tier where you can still get it at a discounted price, often significantly less than the retail cost. So not free,
right,
but easier on the wallet than paying full price.
Right. I can see the appeal there. But then, of course, the question becomes, okay, what if it's not on either list?
Yeah, right.
What if it's something that's,
They do have an option to access those non-formulary drugs,
right.
But it does, it comes with a fee, as you might expect, so...
Right.
Always a good idea to kind of check their specific formulary list and see where your medications fall.
Absolutely.
It's all about being informed, right?
Right. Knowledge is power, especially with these healthcare decisions.
Absolutely.
Now, I just noticed, I think, in the documents, there was specific mention of, like, men's health medication, something about Viagra, Cialis.
Oh, yeah. That's always interesting when they call out those specifics.
Right. In this case, those are actually available through mail order only, and there's a yearly limit. So, it just goes to show, like, even within the tiers.
Right. The details matter.
The details matter.
Read the fine print.
Absolutely.
So we've covered a lot of ground here. We've talked about, that PPO side of things, the provider network, the copays, the telehealth options, now the prescription drug coverage. But we can't forget about this other half of the healthy PPO, which is that whole health share concept.
That's the real differentiator here.
It is. So let's dive into that a little bit. How does that all work?
Well, think of it this way. You've got this network of providers. That's your PPO. And then you have this whole other system working alongside it, which is your ShareWell Health Share. And the key to really kind of wrapping your head around ShareWell is this concept of what they call the unshareable amount, or the UA.
The unshareable amount.
Okay, that sounds kind of ominous.
It's not as bad as it sounds. Like, nope, we're not sharing that. What is that exactly?
Essentially, you can think of the UA like a deductible in a traditional plan. It's the amount that you pay out of pocket for eligible medical expenses.
Okay.
Before ShareWell kicks in and starts sharing those costs with you.
Okay, so it's kind of like your initial hurdle to clear, and then once you've paid that, then that's when they start kind of, sharing those costs with you.
Exactly. And here's where it gets, kind of interesting, is that you can actually choose your UA level. So imagine like a seesaw, right?
Okay.
On one side, you have your UA, and then on the other side, you have your monthly contribution.
Okay.
So if you choose a lower UA, meaning you pay less before ShareWell kicks in, your monthly contribution is going to be higher. If you opt for a higher UA, you're going to pay less each month, but obviously you're going to pay more upfront if you need a lot of medical care.
So it's that classic balance, that trade-off.
Exactly. Finding that sweet spot for you, your own personal risk tolerance.
And your financial situation probably plays a role too.
Absolutely,
Yeah.
absolutely. And they actually give a really helpful example in the document to kind of illustrate this point. They talk about these two members, Jillian and Jane.
Okay, Jillian and Jane, all right.
So Jillian chooses a more traditional plan with, let's say, a $5,000 deductible.
Okay.
And Jane goes with the healthy PPO with a, let's say, a $1,500 UA.
All right, so different approaches. Let's see how it plays out.
So let's say both Jillian and Jane, unfortunately, need a surgery that costs $21,000.
Okay.
With her traditional plan, Jillian is on the hook for that entire $5,000 deductible first.
Right.
And then she's probably going to face, coinsurance payments on top of that, a percentage of the remaining costs.
Right. So that's a significant chunk of change.
Exactly. Exactly. And that's not even factoring in, potential copays for follow-up appointments and medications and things like that.
Right.
Now let's look at Jane. Because she chose that lower UA of $1,500, she hits that threshold much faster. And then Sharewell steps in and starts covering those remaining costs. So in this case, that would be, $19,500.
Wow. So that is a significant difference.
Yeah, it can be. It can be huge.
Right. So even though, yeah, she might be paying a little bit more each month, in a situation like that where you have a,
major medical expense.
right, it really pays off.
Exactly, exactly. And it's not even just the surgery itself, right? Think about all the additional expenses that might come with that, follow-up appointments, maybe some physical therapy, even things like imaging or chiropractic care. Those costs add up really quickly for Jillian.
For sure.
But because Jane has already met that UA, now those subsequent expenses, as long as they're eligible, are being shared.
Okay, so I'm really starting to see how this could be really appealing for folks. But we need to address, I think, kind of the elephant in the room when it comes to health plans, especially one that has this cost-sharing component.
Yeah.
Pre-existing conditions. How does the healthy PPO handle those?
That's the million-dollar question. And to their credit, they address it head on. There's a phase-in period for pre-existing conditions. So essentially there's a 1-year waiting period after you enroll before those pre-existing conditions become eligible for cost sharing.
So for that first year, if you have a pre-existing condition, you're basically on your own.
Essentially, yes, you're responsible for those costs. So definitely something to factor in. Now, it starts to change after that first year.
Okay.
So year 2, they'll share up to $30,000 in costs related to those pre-existing conditions. Year 3, it jumps to $60,000. Year 4, $150,000. And then finally, by year 5, there's no sharing limit.
Okay, so there's the light at the end of the tunnel, but it does take a little while to get there.
It does. It does.
Are there any other, caveats or things that people should watch out for when it comes to pre-existing conditions specifically?
Yeah, they do have a specific call out regarding cancer. So if you've had cancer in the past and you were taking certain medications or receiving treatments, within 3 years of joining the plan, if that cancer were to recur, that would be considered a pre-existing condition, and it would be subject to those yearly limits that we just talked about.
Okay, so that's important to know.
Very important. Now, it's not all doom and gloom. They do list some exceptions.
Okay, good.
So, common conditions, things like high blood pressure, high cholesterol, even type 2 diabetes, those are not considered pre-existing as long as you haven't been hospitalized for them the year before joining.
Okay, so that's a win for a lot of people, I would imagine.
It is. It is.
Well, we've covered a lot of ground today, from the familiar territory of, PPO networks and copays to the maybe a little bit more uncharted territory of health share and this approach to cost sharing.
It's a unique blend.
It is.
That's for sure. And it really is a different way of approaching healthcare. And as with anything, it comes with its own set of advantages and considerations.
It does. And that's really what we wanted to do today, is just kind of give you that information to make those decisions.
Okay.
Because it's definitely not one size fits all.
Yeah.
But as we wrap up this deep dive on the healthy PPO, here's a final thought I'll leave you with.
Okay.
As you're thinking about this plan and others, does this whole concept of community-based cost sharing, of, almost like pooling resources in a way,
Yeah.
to navigate healthcare expenses, does that resonate with you? Does it challenge maybe some of your assumptions about traditional healthcare models?
It's a question worth pondering, that's for sure, as you kind of weigh your options and figure out what's the best fit for you.
Because there's no right or wrong answer. It's really about,
What are your priorities?
exactly. What are your priorities? What matters most to you when it comes to your healthcare?
And that's what it's all about.
And that's what we try to do with this deep dive, is just give you the information and the knowledge and hopefully spark some thought so you can make those decisions.
Exactly.
So until next time, keep asking questions, keep exploring those options, and keep taking charge of your healthcare journey.
Couldn't have said it better myself.